Hello everyone, let's study the applied anatomy of the herbs palsy. I'm Dr. Komala, Professor of Anatomy. All images and videos used in this presentation are from the textbooks of anatomy and various internet resources. The images are used for teaching learning activities only. The video is done to help the undergraduates understand the clinical anatomy. I acknowledge the ownership of the images and give complete credit to them. We shall now look at the upper trunk injury case. A newborn was noticed to have abnormal arm positions, lack of movements of the arm with diminished sensation and poor grip strength. Parents gave a history of prolonged labor and forceps delivery. This position of the hand in this child is called as waiter's tip position. Assuming that you have all understood the anatomy of the upper limb and the brachial plexus, we shall now discuss this case. What is Erb's point? It is a point where the six nerves meet. C5, C6 nerve roots, suprascapular nerve, nerve to subclavius, anterior division and posterior division of the upper trunk. Injury to the upper trunk or the Erb's point will cause Erb's paralysis. Injury to the Erb's point occurs when there is an overstretch between the head and the shoulder during birth injuries, road traffic accidents, surgical complications, and domestic accidents. Whenever there is an injury to the Erb's point, mainly the three nerves are damaged. That is the axillary nerve, suprascapular nerve, musculocutaneous nerve. Suprascapular nerve supplies the supraspinatus. Supraspinatus is responsible for the initial abduction. Axillary nerve supplies the deltoid. Deltoid is responsible for the abduction between 15 to 90 degrees. Because of the paralysis of supraspinatus and the deltoid, the abduction of the arm is lost. Abduction of the arm is lost, and hence you can see the arm left in the adducted position. Axillary nerve also supplies the teres minor muscle. Teres minor is a lateral rotator and the extensor rotator of the arm. Because of the injury to the axillary nerve and the teres minor muscle, the lateral rotation of the arm is affected. Musculocutaneous nerve supplies the biceps and the brachialis. Biceps and the brachialis are flexors at the elbow. Because of the damage to the musculocutaneous nerve and the flexors, the elbow cannot be flexed and it is left in the extended position. The biceps is also a strong supinator of the forearm. Loss of the biceps action will leave the forearm in pronated position. So I will repeat. At the shoulder, there is adduction and medial rotation. At the elbow, there is extension and the forearm is pronated. The hand is left in the tip position. This position of the hand in the Erb's paralysis is called as waiter's tip position, porter's tip position, or policeman's tip position. There is medial rotation, adduction of the arm, extension at the elbow, pronation of the forearm, and the fingers are left as if a policeman is asking for a tip. And hence it's called as policeman's tip hand. Thank you for your patient listening, and do subscribe. Your subscription will motivate me to make more such videos. Thank you.